Welcome to the Healthcare Authority presentation on Classic Apple Health Medicaid and COVID-19. The information in this presentation applies to Apple Health medical programs. This presentation is a collaboration between the Department of Social and Health Services and the Healthcare Authority. In this presentation, we will cover the following topics: COVID-19 updates, extensions to provide verification, self-attestation, change of circumstances and income reporting, Medicare Savings Program or MSP, and Spenddown, Apple Health for Workers with Disabilities or HWD premiums, how to apply for Apple Health, options for uninsured individuals, and resources. COVID-19 updates. In response to the public health emergency surrounding the outbreak of COVID-19, the Healthcare Authority and agency partners are taking steps to ensure individuals maintain their Apple Health coverage. Federal and state authorities continue to provide guidance on how to respond to the COVID-19 emergency. As Healthcare Authority and agency partners receive clarification, updated guidance will be shared with the stakeholders and community partners. The Healthcare Authority strives to deliver important information to partners and stakeholders, especially in times of rapid change. Stay informed by viewing updates posted to the Healthcare Authority COVID-19 webpage. Also, please subscribe to the Healthcare Authority Gov Delivery to receive important updates on Apple Health eligibility, or visit the Department of Social and Health Services website for more resources. Eligibility workers will continue to verify individuals who have an unverified citizenship or immigration status and/or a missing or unverified Social Security number per federal regulations. Reasonable opportunity periods will be granted consistent with federal regulations. Coverage is reinstated for any Apple Health recipient. When coverage was closed on or after March 18, 2020, unless the individual has requested closure, is no longer a Washington state resident, or is deceased. This does not include all individuals with a pay-through date of March 31, 2020. Most individuals should disregard termination notices dated on or after March 18 until further notice. Extensions to provide verification. Individuals who request additional time to provide verification may be granted an additional 30 days. Healthcare Authority and DSHS will be flexible with individuals on what types of verification they are able to provide during this time. Individuals who require additional time and keep in contact with Healthcare Authority and DSHS may request additional time on a case-by-case basis. Let's review some scenarios. Scenario 1. Anthony has received a cash gift from his daughter. When he applies for Apple Health, the worker is not able to verify the amount over the phone, and Anthony cannot remember the amount. Verification for the amount of the cash gift is requested. Anthony has concerns that he will not be able to get a statement from his daughter within 10 days. How much additional time can DSHS grant to provide verification? DSHS is able to grant an additional 30 days for Anthony to provide the requested verification. Scenario 2. Vicky has purchased a new vehicle and calls to report her new resource. DSHS asks Vicky for her new vehicle's year, make, and model to determine its value. Vicky cannot remember what year her vehicle is. DSHS requests verification. Vicky worries that she will not be able to provide verification within 10 days. How much additional time can DSHS grant to provide verification? DSHS is able to grant an additional 30 days for Vicky to provide verification. Self-Attestation. Individuals can self-attest to their income and resources when applying, renewing, or reporting a change of circumstances for their Apple Health coverage. Most applications and renewals can be approved and processed based on attestation of income and resources and available electronic cross-match verifications. Self-attestation that will deny or delay coverage should be verified, such as the transfer of assets or excess home equity for long-term care. Let's review some scenarios. Scenario 1. Susie is applying for Apple Health for the first time. She is completing an application over the phone. She is a permanent resident. The worker does not have access to verify Susie's immigration status. Can Susie self-attest to her immigration status? Yes. Susie is approved and is granted a 90 days reasonable opportunity period, or ROP, to provide verification on her citizenship and immigration status. Scenario 2. Gabby is eligible for the Spenddown program. She has incurred enough medical expenses to meet her Spenddown, but she has lost her medical bills and she is unable to get them from the doctor. How can Gabby prove her medical expenses? Gabby contacts the DSHS and self-attests to the amount of her medical expenses. The DSHS accepts her self-attestation and approves her Spenddown so that she has active Apple Health coverage. Individuals who are homeless and have been closed for whereabouts unknown will have their coverage reinstated based on their attestation of their current circumstances. Change of circumstances and income reporting. Individuals will not lose Apple Health coverage or have a decrease in benefits during the emergency unless they move out of the state or request termination. This includes individuals who had Apple Health as of March 18, 2020 and new enrollees. Individuals who are receiving long-term services and supports should report income changes and contact their public benefit specialist. During the COVID-19 emergency period, individuals should continue to report the following to DSHS: pregnancy due date, change of address, household size, change of income for individuals receiving long-term services and support, change of resources, and deductions to cost of care if receiving long-term services and support. The DSHS eligibility staff will not terminate or act on changes that may cause ineligibility. The CARES Act created 3 federal benefits related to income. These are the stimulus checks, the federal pandemic unemployment insurance, and the expanded and extended unemployment benefits. Only the expanded and extended unemployment benefit is countable for Apple Health coverage. The stimulus check is excluded as income and a resource for 12 months. At the 13th month, the individual will need to report if there is any of the stimulus check remaining. This applies to all classic programs. Individuals who are submitting a new Apple Health application should report all countable income, including the expanded and extended unemployment benefits. it is not required to report the stimulus check and the federal pandemic unemployment insurance of $600 per week. Let's review some scenarios. Scenario 1. Participation in an institution. John is in a nursing facility since February. His $1,000 pension is deposited into his nursing home trust account every month. On June 1st, he starts receiving his $300 Social Security disability. Can DSHS increase John's participation to the nursing facility? DSHS needs to be notified of the change. During the COVID-19 public emergency, John's participation towards the cost of care cannot increase. His nursing facility client responsibility will continue to be based on $1,000 pension, allowing the personal needs allowance and any established deductions. Scenario 2. Participation at home. Mary lives at home and receives personal care and Meals on Wheels services. Her participation is $150 each month based on her income and allowable deductions. In July, her pension increases by $70 due to a COLA increase for 2020. Will Mary have an increase to her participation in August? No. Mary's participation during the COVID-19 public health emergency remains the same as it was on March 18, 2020. DSHS will update her participation once the public health emergency is over. Scenario 3. Changes to income. Mary is on Classic Apple Health Categorically Needy program and has no income. On May 4, 2020, she reports her Social Security disability has been approved and her income will be $1,000 starting in June 2020. This income will cause her scope of coverage to change to a medically needy Spenddown program. Can DSHS reduce her medical scope of coverage? No. During the COVID-19 public health emergency, Mary will remain on a categorically needy program. DSHS will update her case once the public health emergency is over. Medicare Savings Program or MSP and Spenddown. Medicare Savings Programs are Apple Health programs that help pay some of the costs that Medicare does not cover. MSP recipients will not have a reduction of benefits during the COVID-19 emergency. This includes the scope and amount of benefits. DSHS is the agency responsible for processing and updating the MSP cases. Let's review some scenarios on MSP. Scenario 1. Jennifer is currently receiving Qualified Medicare Beneficiary or QMB benefits. Jennifer calls customer service to report an increase in income. She is concerned she may lose her QMB benefits. What is the outcome of this scenario? Jennifer's eligibility remains the same during the COVID-19 emergency period. The DSHS will not take action to reduce or terminate her benefits. Scenario 2. Chris is currently receiving Specified Low-Income Medicare Beneficiary or SLMB benefits. He calls customer service to report a decrease in income because he lost his part-time job due to COVID-19. What is the outcome of this scenario? Due to the decrease in income, Chris may qualify for the QMB program, which is a more comprehensive program than his original SLMB program. His eligibility is redetermined. Increase is approved for QMB. Spenddown is the amount of medical expenses for which an individual is financially responsible for before Apple Health is available and authorized. The individual is liable for the expenses used to meet the approved spend-down period. Once an individual meets their spend-down, Apple Health is available for coverage. During the emergency period, individuals are able to self-attest a change in income, resources, and incurred medical expenses for spend-down purposes. DSHS is the agency responsible for processing and updating the spend-down case. Let's review some scenarios. Scenario 1. Self-attested resource. Brittany receives Social Security income and applies for medical through Washington Connection. She does not have a bank statement to verify her resources. She states her resources are below the $2,000 resource limit. What is the outcome of this scenario? The DSHS accepts Brittany's attestation and her application is approved. The DSHS can accept her attestation regarding the value of the resource if there is nothing else to verify eligibility. Scenario 2. Self-attested incurred liability. Justin is undergoing cancer treatment. He has a 3-month spend-down base period that begins in February. On April 10th, he reports an incurred medical expense in excess of his spend-down amount. Justin lost his copy of the bill. What is the outcome of this scenario? The DSHS accepts Justin's statement regarding his incurred cost, and spend-down is approved. Workers with Disabilities or HWD premium. Premiums obligations for HWD coverage are waived for April, May, and June. This includes any premium being billed for a prior month. Outstanding premiums that are due for benefit month prior to April will be waived. If an HWD recipient loses their job due to the COVID-19 emergency and it is time for their eligibility review, the employment requirement is waived until the emergency period is lifted. Please note that HWD applicants still must meet their employment requirements. This section covers how to apply for Apple Health. Apple Health may be available to individuals who do not have health care coverage or can act as a secondary payer if an individual has other coverage. Applications can be submitted at any time throughout the year. While most applications for Apple Health may be submitted through Washington Helpline Finder, applications for individuals age 65 and over or who are blind or disabled can be submitted via Washington Connection. During this public emergency, we encourage all individuals to apply for benefits. Individuals who may not qualify for Apple Health may be eligible for a Qualified Health Plan or QHP. The staff at DSHS determine eligibility for Apple Health programs for individuals who are age 65 and over, blind, disabled, or need long-term care services. Applications for these programs can be submitted online, through Washington Connection, mail, fax, or phone number at 1-877-501-2233. Long-term care applications can be submitted via online, through Washington Connection, by mail, or fax. Also, For long-term care programs, assessments are requested through the Home and Community Services Central Intake Lines. These are divided by regions. This slide shows the different regions and their contact information. MAGI-based medical programs are administered by Healthcare Authority through the Washington Helpline Finder portal. Individuals applying for Apple Health coverage can submit their application via online, phone, mobile app, or paper application. Options for uninsured individuals. The U.S. Department of Health and Human Services has established a provider reimbursement program for COVID-19 testing and treatment for uninsured individuals. The Federal Health Resources and Service Administration, or HRSA, has created a web portal to administer this program. Individuals who do not qualify for Apple Health, QHP, or other healthcare coverage may be eligible and should work with their provider. Visit the HRSA COVID-19 Uninsured Program portal for more information. There are many resources available to stay informed on COVID-19 and other Apple Health topics. For more information on COVID-19, visit the Healthcare Authority webpage. Individuals can also stay informed by visiting the Healthcare Authority Stakeholder Training and Education webpage. Healthcare Authority has made available Apple Health Policy Representatives. These representatives serve specific areas. Individuals can visit the Developmental Disabilities Administration website for more resources, and the Aging and Long-Term Support Administration website for more information. Resources on this page include information on long-term services and support assessment, Medicare Savings Program, Apple Health for the Medically Needy and Spenddown overview, HRSA COVID-19 Uninsured Program, and the cross-agency DSHS, which includes contact information for DSHS, Healthcare Authority, and the Health Benefit Exchange. Thank you so much for taking the time to view this presentation.